Welcome to Georgetown University in Qatar's Pandemic Panels. If you are joining us today, I am Ahmed Dalal, Dean of Georgetown University in Qatar and the moderator of what we are calling the Pandemic Panels, 3 virtual panel discussions which gather some of our faculty experts to reflect on this global human crisis from their respective areas of expertise. The focus of today's panel discussion is governance in a time of pandemic, a global view. The panel addresses global governance as well as national policy responses to the COVID-19 pandemic. The purpose of this panel is to investigate the types of global pressures that influence national policies and which national policies in turn are influencing global policy, as well as the governance of the policy at the national and local levels. It is meant to follow our first panel titled The COVID-19 Pandemic, Historical and Cultural Perspectives. Joining me today on today's panel is Dr. Amanda Garrett, Professor of Political Science at Georgetown University in Qatar. She specializes in comparative and international politics with a focus on the implications of migration and ethnic diversity in advanced democracies. Dr. Garrett's work examines the conditions under which religious or ethnic minorities engage in violent conflict as a means of political expression in France, the UK, Netherlands, and the United States. We are also joined by Dr. Maurice Jackson, Professor in the History Department and the African American Studies Program at Georgetown. A 2009 inductee into the Washington, D.C. Hall of Fame, he was appointed by the mayor and the council of the District of Columbia as the first chair of the D.C. Commission on African American Affairs from 2013 to 2016. He is the author of a special report on African American employment, housing, and population trends in D.C. for the D.C. government. Our next panelist is Dr. Anatol Lieven, a professor of government with wide-ranging regional expertise. He was the former chair of International Relations and Terrorism Studies at Work Studies Department at King's College London. He is a former conflict zone journalist, and he has recently published a new book on national security titled Climate Change and the Nation State, The Realist Case. And last but not least, we have Dr. Clyde Wilcox, Professor of Government at Georgetown. A prolific author with more than 30 authored and edited books, he writes on a number of topics in American and comparative politics, including religion and politics, gender politics, interest groups, public opinion and electoral behavior, campaign finance, and perhaps most interesting, science fiction and politics. Thank you all for joining us today and adding your specific expertise to our discussion. I would like to start with a discussion of the impact of globalization on a national and on national policies. And I will start with a general question. Dr. Lieven, could you give us an overview of how this pandemic has affected global politics and how individual countries have responded on the national level? And more broadly, what are the long-term effects of the increased tension between the world's largest powers?
The deepest long-term effects, I think, will be a considerable reduction of globalization. Not an abolition of globalization. Global trade, global finance will, of course, continue. But we are seeing much greater emphasis on national resilience, national self-sufficiency in various fields. And I think that will, to some extent, continue after the pandemic. Hopefully, it will not lead to full-scale tariff wars, because if we go into full-scale tariff wars, as in the 1930s, then we're liable to return to the economic conditions of the 1930s. As to great power relations, clearly relations between China and the United States have got even worse as a result of the pandemic. And that, I think, will continue even if the Democrats win the presidential elections in America in November, because the Democrats too have been talking a very anti-Chinese talk in recent months. Where the November elections will have a major impact, however, is on US-European relations and where Europe will stand in this Chinese-US rivalry. Because in Europe, you've had 2 strands of opinion. One, the old Atlanticist stand, which really wants to stay with the US and rebuild the Atlantic Alliance, but now mostly directed against China, not Russia, and mostly economic interests, which are desperately anxious not to break economic relations with China. And if the Democrats win, you'll see an attempt to restore the old alliance. If Trump wins, that will be much more difficult. The Atlanticists will be weakened, and I think you'll see much more of an attempt of the Europeans to a degree to balance between the USA and China.
Thank you. Dr. Garrett, the pandemic is a global disaster that underscores the need for devising better ways of dealing domestically and internationally with current and future fundamental challenges to humanity. However, in the chaotic response to the pandemic, many governments have retreated into isolation, hiding behind the usual categories of ethnicity, religion, race, and nationality, building walls, and blaming others for our common predicament. Do you think the world will become more polarized, more selfish and xenophobic, or are we likely to witness a better global cooperation in the service of humanity?
Yeah, I'll echo the comments of my colleague. I think we've seen trends in both directions. Unfortunately, up until this point, I think we've seen probably more movement in the direction of isolationism, of polarization, of xenophobia than we have in the direction of global cooperation. So, in terms of international cooperation, there's been, a lot of criticism about how that's been pretty insufficient. The knee-jerk reaction of a lot of countries was, again, to sort of hunker down and protect citizens. We've seen a renationalization of policy and of politics. The first response of many countries was to shut borders. So we've got about 170 countries now that have shut off their borders in some capacity, either fully or partially. We've seen, even in some cases, a relocalization of politics, particularly in federal countries. So the United States, Germany, Italy, where states and local level jurisdictions are acting in their own sort of self-interest. We've seen an increase in competition, unfriendly competition between states, competition over PPE materials and resources, so masks and ventilators. Some countries have banned the exports of these. Others, like the United States, have been accused of sort of rerouting shipments. So it's been a bit of a zero-sum game that many countries are playing. Each man for himself in some senses. And maybe predictably, we've also seen an increase in xenophobia. So we know that catastrophes, economic catastrophes, health catastrophes, they increase fear, and that is oftentimes correlated with an increase in nationalism, xenophobia, scapegoating, and that's unfortunately what we're seeing. We've seen an increase in hate crimes and hate speech, particularly targeted towards Asian and Chinese minorities in many countries. The human rights organizations and the United Nations have explicitly issued warnings to states to crack down on this behavior. On the other hand, though, we have seen a little bit of solidarity, mostly at the local level. We've seen sort of civil society organizations really step up and mobilize resources. We've seen these sort of small zones of cooperation between states. German hospitals are now treating French patients and Italian patients, but not really at the global level yet. And like my colleague, Professor Lieven, I don't know if we're going to see a return to that anytime soon. I think countries are much more strategic now. They've managed to build strategies to deal with this isolation. Citizens want their national interests and their livelihoods protected. We'll return to some sort of global normal relations probably in the medium to long term, but for now we're still pretty much very focused on national interest.
Thank you. Along similar lines, Dr. Wilcox, an emerging dynamic in the US as a reaction to the pandemic is the move towards isolationism. This might be explained as a deliberate political manipulation of the crisis, but it can also be seen as a byproduct of the failures of globalization. What are the likely outcomes of this dynamic, and what effect would these outcomes have on the global order?
Well, you know, throughout the 20th century, the American people have been isolationists in almost every survey that we do. American people don't want to send troops overseas. They don't want to send foreign aid overseas. But there's been an elite consensus that America needs to be involved and actually play a leadership role. In this pandemic, though, our role has been to criticize our allies, to act unilaterally, to even try to buy exclusive rights to vaccines and medicines. I think this mostly reflects Donald Trump's worldview, or what passes for a worldview for him. His isolationism has been erratic. He has praised China and condemned China. He sent supplies abroad and then taken them back immediately. He seized supplies abroad. This is very unusual for America. In the past, we have been cooperative with our allies. The CDC has been taking a leadership role along with health organizations elsewhere. So I think a lot hinges on the election. If Trump loses in November, then I think, as Anatol says, the Democrats will at least try to strengthen the Atlantic Alliance and maybe tone things down a little bit with the Chinese. I also think that the Republican Party might be tempted to nominate someone from the more internationalist wing in the next election. On the other hand, if Trump is reelected, then I think that will be the dominant GOP position for the foreseeable future. And then final thought is that a lot of this depends on how the virus proceeds. So based on the best data I can see, maybe 5% of Americans have been exposed. To get to herd immunity, you need somewhere around 65%. So we don't know how big the virus will be, how many people will die, how much economic damage will be done, and that will certainly affect the isolationism that countries encounter.
Thank you. Dr. Jackson, we are witnessing throughout the world the appeal of authoritarianism and the potential for power consolidation in a time of crisis. During a crisis, are the people more likely or less likely to be heard? When an authoritarian rule is required to stop the spread of a disease, what civil liberties come under threat? And what does this mean for the creation of, for the creation of future policies?
Thank you. You know, I'm an African-American man. I grew up in the dark days of the South. I grew of age. I spent many years on the road, traveling throughout the world. I saw the taking away of rights in places like Chile. I witnessed the period of the taking away of rights of people in Tiananmen Square. You saw it in South Africa. And when I look at this, the only answer I can give is there's nothing that exists that the extension of democracy won't handle. So it's not time for authoritarianism, it's time to extend democracy. And what I mean by that is if people believe that they will be treated equally during this crisis, if people believe that when stores are open and they can get the resources necessary, when people believe that they will have jobs, when people believe that they will have these rights, but when people look on TV and they see what happened in Georgia and they see a black man just running, just jogging, doing nothing but being a decent human being, and he's shot, and then they see that this could be supported by state authorities, then that is when they worry. You see, the extension of democracy is so important because this year becomes an election year, and people will want to know if they will have the right to vote equally, that it would not be separated and only those with in certain locations. So this becomes the problem. You know, the only time I can see, and I'm careful about saying this, the only time I can see the taking away of certain rights will be when it's time to give when the antidote is discovered, and when it's time to make sure that everybody gets the antidote. And then it will be important for authorities to guarantee that everybody gets it. And so therefore the people who are poor or rich don't just run because it's going to be chaos. I'm hopeful that it will come soon. But And then when you have the taking away of rights, the taking away, it means that Black people will lose the rights first, or any minority people lose the rights first and get them back last. We saw what happened in Chile not so long ago. We saw what happened in India not so long ago with the Muslims. There is a danger, and there's a danger, of course, for anybody who sees themselves as the other.
Thank you. Dr. Garrett, an appeal to nationalism can help citizens make big changes. Do you think there is a chance that the pandemic might have a positive effect on tackling such entrenched problems as poverty or racism or other long-standing structural, social, and political problems? And more specifically, what effects has the pandemic had on patterns of global migration and on domestic response to immigration?
So I'll sort of address the questions together. And the reason for that is I think one of the things that the pandemic has done is it's really, laid bare some of the major critical flaws in the system. And one of those flaws is that, we have huge populations that are extremely vulnerable to these sort of, economic shifts, to these health crises, to these political maneuvers. And one of those groups, of course, is, immigrants, minorities, immigrants, asylum seekers, refugees, undocumented migrants. They're exceptionally vulnerable to the effects of a health crisis. So in a sense, you sort of have this health crisis that is being layered on top of pre-existing crises in society. And, in terms of states making nationalist appeals, engaging in these sort of nation-first policies like we've seen, I think there are a couple of scenarios that are, likely to play out. And one of them, unfortunately, is a sort of a pessimistic outlook. And the reason for that is it's likely that these vulnerable populations will get even more vulnerable, right? Their vulnerability will sort of be exacerbated. We've seen that migrant populations play a really important role in national economies, but unfortunately, they oftentimes sort of live and work in zones of the economy and of society that are either in the shadows or that are deemed to be dispensable in some way. So they become especially vulnerable during these times. We've already talked, sort of alluded to this idea of increasing xenophobia, increasing scapegoating that we're seeing. I think there's also a really dangerous humanitarian impact that this is going to have. And this is primarily because what we've seen is a lot of states, the United States, Hungary, Uganda, Italy, Malta, is sort of enacting these border controls that keep migrants out, that keep refugees and asylum seekers out. And there's the danger that these things which we deem are temporary, they might actually turn out to be more permanent. You limit mobility, you limit the ability of refugees and asylum seekers to move away from danger zones. They, of course, have the legal right to do that under the UN Convention, but that sort of stops at the border. And to the extent that borders are closed, and we know that, of the 170 countries that have closed off their borders, 57 of them have actually made no exception for asylum seekers and for refugees. And that's a huge problem for vulnerability. But there's some reason to, be, I guess, positive, or to have a slightly more positive outlook to answer your question. And that's because we do realize that these are significantly important segments of the population. Again, immigrants, asylum seekers, and even undocumented workers. In Europe, the minute that EU internal borders sort of went up, the first thing countries realized is that they couldn't have access anymore to the migrant labor that worked in agriculture, and that was a big issue. So to the extent that this is, paints immigrants and migratory populations in a positive light as benefits as opposed to burdens, that's definitely a benefit.
Thank you. Dr. Jackson, to stay on a similar theme, I would like to talk now about some of the effects of different policy responses on average people. It's been noted that COVID-19 has had a disproportionate effect on poor and minority communities. In the state of Georgia, for instance, with a 30% African American community, 80% of the total infections are in that community. The virus, of course, does not discriminate. So what explains the pandemic socioeconomic gender race gap? Why do impoverished communities continue to pay the highest price? And more broadly, and I know that you've worked on policy and the effect of policy on real life situations, how does policy shape someone's lived experience, and how does that affect them during a crisis?
Thank you. We have a saying at home that the local is the global is the local. And I think this really shows itself with this. In Washington, D.C., for example, the Black population is diminishing. Now it's less than 50%, but about 85% of all the cases have been amongst African Americans. The deaths are even higher. The death rate amongst Blacks is even higher than that. And there are many things that lead to this. First is the general economic and social conditions of Blacks themselves. You judge, in any country that I know of, you judge health conditions by two things: infant mortality and lifespan. The infant mortality rate in Washington for Blacks is 7 times for whites, 14 versus 2 per 1,000. The lifespan for Blacks in Washington, D.C., just an example, Washington, is 12 years or less, 12 years. And why should that be? The diabetes rate is 7 times higher, the rate of strokes. And during crises like this, what happens is that especially poor people who may not have a hospital near them, they generally go to emergency rooms. Now emergency rooms are closed. So the rate of strokes has really gone way up, as I've seen. And a lot of this is historic, within the historic African American community. The rate of high blood pressure, things like this. And a lot of this has to do with, number one, not having the living conditions that people live into. Number two is access to health care. For example, in Washington, D.C., there's not a single public hospital, which means that that most people do not have a place that they can go. They have been closed. So we have those conditions. The other thing is where people live. If you look in Washington, most of the places that have high cancer rates, that by this I mean bus barns where the buses turn around, or where they have big electrical conduits. Those things are located in the Black community, and these are what cause severe health conditions. So I think these are those, and the policies, we can speak about the policies pretty soon, but the policies is not very difficult to figure out. You have to have access to health care, and you have to have this in the communities that people live. You have to have community-based health care, and it's possible. But just the last thing that where I live at and where I've looked at in Washington, they've been a bit slow in establishing hospitals, tents and things like this for an emergency. We expect, just in Washington, the spike to go up in about a month or so. And I don't know if the authorities have dealt with it. And part of that, I think, is because they're Black people.
Thank you. Dr. Wilcox, in the new political formulations that are likely to arise, what effect can the people have on local and national policies? What role do social movements such as the protests to reopen the economy, as well as other longer-term social movements, play in government policy making? And what other interest groups have a major say in what policies get made?
Thank you. That's a good question. So interest groups and social movements play a big role in America at national, state, and local politics. Currently, small businesses are pushing in all the states to open very quickly because they have very small margins and they want to get their income flow coming back. Big business, which managed to grab most of the stimulus, is pushing for a slower, more cautious reopening because they're afraid of the long-term implications of another outbreak. But they're also pushing, along with universities, for legal protections from lawsuits of people who are injured by a reopening and become sick. So workers, students, customers, and so forth. Public health groups are pressuring for more testing, for mandatory masks. Civil society groups are providing food for the elderly and they're making masks at home to distribute to their neighbors. But the most interesting and the most disturbing part of this, of course, is that across the country, groups of white demonstrators have descended on state capitals, in some cases blocking ambulances and demanding the right to get a haircut or a Starbucks coffee. There's an iconic photo of a white woman leaning out the window of a car spewing racism at an Asian American nurse who stands there inflappable with his arms crossed, keeping the street open for an ambulance. In some states, groups of heavily armed white men, sometimes with rifles longer than they are tall, wearing bulletproof vests and masks, have descended on state capitals, in some cases threatening lawmakers and governors with violence. In Michigan, some of them carried Barbie dolls with nooses around their necks, an implicit threat to kill the governor. Now, what's really troubling here, not only is that this is happening, but that President Trump and some, though certainly not all, Republican lawmakers have endorsed these groups. President Trump has encouraged them to liberate their states, and he said there's good people in these marches and the governors should negotiate. Now, the question is, how do we think about this? Is this really a social movement? Is this simply a group of crazy militia people feeling empowered? What we do know is that some of these people are genuinely activists, and so they would be out there regardless. But we also know that there's a lot of money flowing into these groups to help coordinate, including from the DeVos family. The conservative donors are helping create the possibility for this. One of the things that I think is really difficult to say is where this goes from here, but I find this very worrisome. It seems to me that every day these demonstrators become a little more empowered. Before a shark will bite you, it bumps you 2 or 3 times to make sure you're not a dangerous thing to bite. And it seems to me that's what these groups are doing, is they're bumping and bumping. And so it seems to me maybe time for the Michigan governor to call out the National Guard and get these people under control.
Thank you.
May I follow on?
Please, let me repeat the question just in case we need. I'll repeat the question and then we'll start again with the question. So Dr. Lieven, how in your view is the global pandemic being treated? As a national, as a health emergency, as a security threat, an economic crash? What are the policy implications of how a country and the world views a pandemic?
Well, as I say, I think in response to the pandemic itself, you will see mixtures of all these responses with a different balance in different countries. But I think where the response will really diverge is when it comes to the economic crisis. And I think Clyde has really highlighted the dangers of this as far as America is concerned. Because now, of course, if we're very, very lucky, we will see a rapid economic return after the pandemic. But if we're only moderately unlucky, we will see an economic depression with high levels of unemployment lasting for a considerable time. And of course, there have been, some scenarios drawn out for, really, really severe economic problems. Now, they will put the most intense pressure on almost every political order around the world. And I mean, what we have to hope for, I think, obviously, is that countries, including the United States, will be able to respond with something along the lines of their own versions of a New Deal, if they can afford it, as America did in the 1930s. New emphasis on social solidarity, national solidarity as well, if you will. Obviously, much stronger support for the unemployed, possibly moves towards systems of universal basic income. Because if not, or if a political order fails to generate this kind of reform, then I think, as Clyde has highlighted, I mean, there is a tremendous room for a rise in many different kinds of extremism. Mostly, I suspect, of the right, but in some places of the left as well. After all, this is what we saw in the 1930s. America was very, very lucky to have Franklin Delano Roosevelt and the New Deal. Other countries, Germany, Japan among them, were not so lucky. One other thing I would say, though, following on from what Amanda said, is that if high levels of unemployment persist for a long period, then inevitably countries will look again, I mean Western countries will look again at their immigration policies, because to maintain high levels of immigration in combination with high levels of unemployment, now that would be a recipe for not just right-wing populism, but genuinely for something that might tend towards fascism.
If I may follow up also, Dr. Lieven, and ask you a question related to some of your recent work, which underscores the intersection between environment, human development, and global pandemics. In what ways should intersection inform policy? And specifically, if you could talk to us a little bit on the environmental side, if the current pandemic might trigger some more serious treatment of the environmental challenges.
Well, it certainly should. And my book should sell millions of copies, because one of the points I made in the book was that the health effects of climate change, including the spread of tropical diseases and of heat waves, was going to impose casualties, deaths on countries vastly in excess of any that they have suffered in recent wars or are likely to suffer in war. Well, of course, the pandemic has really emphasized that. America is well on the way, very close, in fact, to losing as many dead from the pandemic as it lost from the Vietnam and Korean wars put together. Russia will soon have passed the figure for its military dead and dead from terrorism in Afghanistan and Chechnya put together. And other India is facing casualties from the pandemic vastly in excess of those it has lost in wars with Pakistan or Kashmir. And of course, the economic damage of the pandemic also vastly exceeds anything that China has done to the United States economy, or China or Russia or any other country could or indeed would do to Western economies. So the lesson should be that we need to radically rethink what are the real threats to our populations, to the lives of our citizens, to our national interests, to our national economies. That's what should happen. Will it happen? Well, I think the biggest test will be, once again, the response to the economic crisis. Voices have been raised saying that this is an ideal opportunity. Well, not ideal, one can't call this dreadful situation ideal, but it is at least a good opportunity for stronger moves towards a Green New Deal. Because one thing that the pandemic has already revealed is that all these arguments about money not being available are nonsense. In a real crisis, we can generate huge amounts of money. The question is what this money will be spent on. Ideally, it will be spent on restructuring our economies away from carbon fuels towards green energy and towards a real boost for new technological green industries. Now, I'm still somewhat hopeful that this will happen in certain countries. If the European Union, for example, can get its act together in terms of new stimuli, which is by no means certain. What I'm afraid we've seen so far in the United States is that the usual culprits have managed to get their paws on the overwhelming majority of the money that has been generated by Congress for economic revival. In other words, it is, as usual, the corporations and Wall Street and other interests. And there is obviously a very, very grave risk, at least in the United States, that this is indeed the way that things will go, and that a tremendous opportunity to turn this disaster to at least some good effect will be lost.
Thank you. Dr. Garrett, the COVID-19 virus pandemic has also caused concerns for the people outside the global north. Many regions of the world face the virus with few high-tech medical resources, strained or absent healthcare options, greater population density or population migrations, and existing socioeconomic disadvantages. So how will these vulnerabilities play out in the immediate response to the crisis and in the new political formations that are likely to emerge in its aftermath?
Yeah, we've been mostly talking sort of about the global north, and we hear most about the global north in the news, but obviously this is affecting, the global south. Just the numbers coming out of Latin America now attest to that fact. I mean, the public health crisis is universal, but like you said, there are different factors that essentially impact how a country is going to be able to respond to it. Different health infrastructures, regime types, state capacity. And we know, for example, that states that have low trust in public government institutions have a very hard time implementing policies, especially public health policies, and people are maybe less likely to abide by the law. There's no single model, I think, for the global north or for the global south. There's a lot of internal complexity when we're talking about these regions, but there are a couple of things or a couple of consequences rather that I think are going to be fairly universal. And the first one, of course, is economic. And I'm talking specifically about remittances, about foreign direct investment. We have about 250 million migrants around the world that are last year sent about $600 billion back to their home countries. Mass unemployment means that wages are going to dry up, people are sending less money home, and the sort of trickle-down effect of this is less investment in education and infrastructure. And this has pretty significant impact for countries of the global south. In 2008, during the economic crisis, the percentage of remittances declined by about 7% globally. It increased pretty quickly thereafter, but now the World Bank is actually estimating that in this crisis climate, we might expect a drop of about 20% in global remittances. And you can imagine the consequences of that, the economic consequences. Another thing to probably consider is regime. Regime stability, authoritarianism, like we talked about before. Governments everywhere are implementing stricter, more draconian policies in response to the public crisis. But the risk, of course, is that when this is over, some countries, some governments may not be willing to relinquish that power. And this is certainly not unique to any regime type, but may be more likely to happen in countries with limited democratic consolidation. We're seeing this actually at the moment in Hungary. President Orban has sort of consolidated his power and taken a lot of power away from parliament, away from the media. So we're watching it happen many places in real time.
Thank you. Dr. Jackson, to go back to a subject, you alluded to this early on, but if I may ask you more on this subject. And to draw on your own experience and something you've written about and researched, could you talk to us about the types of policies that lead to inequality and what role social activism has played in changing these policies? What role can social activism play in the current crisis?
Thank you. We at Georgetown have been doing extensive study on effects of slavery in America. And sometimes when people think about this, they would say this was 200 or 300 years ago. Well, if one never achieved the equality, it doesn't matter if it were 5 years ago or 100. You see, one thing that blacks face is what we call the great wealth gap. Just in the city I live in, the wealth gap between a white and black is 300 times. That means a white person is likely to have $300,000 to a black's $3. And what does this come about? The wealth gap is just one thing. It's what you own as opposed to what you owe. And people have this large, which means houses and things like, and it takes generations and generations. There are many other examples of this that we go into. The median income for a black family in Washington is about a third of what it is for a white family. The educational level is about a quarter. So you have all of these things that compound and just build up over generations. It would be like, here, I don't know European football here as well as I do an American version of football, but it would be like a Barcelona playing the club team, and the club team have 3 men down. You would never catch up. It's just impossible unless social policies and programs are put up. And that becomes important. Housing programs, job programs, apprenticeship programs, and jobs and healthcare and all these things. And you can see the effect that it has. Even in Qatar, I can see the effect, what happens when there's a system of bringing in healthcare workers and trying and education and educating young women and taking care of things that hadn't been taken care of for generations. So you have all of these things. But at the same time, you have a thing, and I think Clyde and Anatol built upon. These things, when they come in, they inherit, they bring out certain levels of racism. This year, 1919, as you recall, we've been discussing what happened 100 years ago. And one thing we found was that, especially in the United States, when soldiers came home, they were so resentment of blacks. They thought they had something. In this crisis, we have to be very careful that these groups who are coming in and spewing this hatred that Clyde has talked about, and the first thing they would do would be to blame the problems on the blacks, the immigrants. But the immigrants who have or have not had jobs, a job that the whites themselves would not take. So it would take a long list, and I think Anatol spoke about it, of during the New Deal, there was something called the 4 freedoms: the freedom from want, the freedom from fear, the freedom from hunger, and so we would need programs that would guarantee all of this. Is there money? Of course, there's money in the treasury. The problem is, as Clyde, I think, has shown, that the money is going to the larger big business and things like that. But we would need an extensive, and this is the time to equalize society. This is the time to make sure that programs affect, because if we look at the jobs lost, a lot of these jobs are going to be lost in inner city communities. Do you know that where I live in Washington, D.C., as I said, there are no stores, which means people have to get on the buses, public buses, to go 10 miles away, and therefore suffer from problems there. And there are other questions like this. Lastly, I would say this, even educationally, it has an effect. You know, at Qatar, we've had big debates about education and pass-fail and all these things. Do you know that in most communities, in African-American communities, people do not have access to the internet? They have telephones, which means people are behind already, and they'll be farther behind. So the inequalities they just jump at you in crises like this.
Thank you. I would like to address now national responses a little deeper. Dr. Wilcox, the world is witnessing the unfolding tension in the US between state and federal governance. What are the origins of this tension, and what are its likely long-term effects, both immediate effects on the way the pandemic is addressed, but long-term effects beyond that? And how will the crisis affect the future of democracy in America and around the world?
So a pandemic is the perfect problem for a federal system. Federal systems are flexible in administration, but a pandemic goes everywhere. And so pandemic requires coordination, which a country made up of 50 separate states has a hard time pulling off. Mark Roselle and I, though, have recently done a study of 4 federal systems: Australia, Germany, Canada, and the US, which we chose. They were countries we had highlighted in one of our books, but because they vary from right-wing to left-wing governments, from centralized to decentralized, strong parties to weak parties. And what we found was that there's really one set of responses for all of the federal systems we studied, except for America, right? So regardless of the centralization or the strong parties or right-wing governments, Australia, Germany, and Canada ended up with very similar solutions. The national government met together with the heads of the lander and the provinces and the states, brought in scientists and public health officials. The regional governments basically shut down at roughly the same time with roughly the same sets of restrictions. They coordinated with each other. They're beginning to reopen in similar ways. And each of these 3 countries created a stimulus that was much more like what Maurice and Anatol have alluded to, that is to help workers, right? So essentially money went to companies, but it had to go to payrolls, right? It had to keep people having income coming in. In the US, it's been a disaster, right? Some states didn't shut down at all. Some states shut down but allowed very large church services, which are super breeder events as people sing and spew the virus out from their lungs. Some have shut down and remain shut down. Donald Trump has criticized his own public health officials. He's criticized the states, especially those run by Democratic governors. As I said before, he urged these armed demonstrators to liberate the states. And he's basically saying now we should pretend the virus is gone, after having said for a long time that it was basically a hoax. So the explanation is not between the various kinds of federal systems, it's between everyone else in America, right? And so I think two factors lead to the American distinctiveness. First of all, Donald Trump is catastrophically unprepared for this role, right? He's someone who doesn't study, who doesn't read, who likes to pretend that everything is positive. He ignored the crisis for 2 months. He repeatedly called it a hoax. He's now claiming that the death totals are exaggerated. For a while, he had daily press conferences where he attacked female reporters, especially female minority reporters, questioned his own public health officials, and praised himself copiously. He talked even about injecting disinfectant as a cure for the virus. More systematically, he, instead of coordinating a national response to buy testing and equipment, he forced the states to bid against each other, which pushed up the price. Sometimes he entered in as a national government bidding against the states to push up the price higher. When states bought testing equipment or public safety equipment, he sometimes seized it and redistributed it, often along political lines. So it led to, I think, what is maybe the iconic moment that symbolizes America's failure. The governor of Maryland, who by the way is a Republican, purchased a lot of testing from Korea, which has state-of-the-art testing, and is hiding it in a secret location protected by National Guard troops from his own party's president so that they don't get seized and taken away, right? So Donald Trump is a big part of this problem. We have had big viruses in the past. Presidents have responded reasonably. And actually, I think Barack Obama did really well in a couple of his cases. But the second problem is that America has become very politically polarized. And in particular, the Republican Party has become more of an opposition to everything party. And so the party leaders have encouraged their supporters to not just distrust the media, everything is fake news, and distrust government, which is the deep state, but even to distrust science. And in some of these marches, there's the sign that says that science is fake news. And as a result, many strong Republicans, although not all, no longer trust any source of information except for their own party leaders. Now, I'm going to point out this is not all Republicans. The governor of Ohio and Maryland have been very strong, listening to their scientists and so forth. But in the South, we have states like Florida and Georgia, which opened up right away, and which are doing various ways to hide the impact of the virus. Georgia recently released a graph that had reordered the days. So Tuesday is not after Monday. They have reordered the days to make the line go down. It turns out Tuesday is after Monday everywhere in the world. And Florida has ordered their medical examiners to no longer report the cause of death because they don't want to have the death totals. So America is a total disaster on this. In a place where we should be maybe at least working with our allies, maybe doing leadership, we are probably the most disastrous developed country in the world. But I don't think this is a result of just federalism per se. It's true that America has 50 states compared to 16 lander in Germany and smaller numbers of provinces and territories and states in Australia. But in the past, federalism has not been a disaster. Governors have come together across party lines when they had a president that worked with them. And so I think we look at America's failure as a failure of leadership.
Thank you, Clyde, for this sobering assessment. Dr. Garrett, on the other side of the Atlantic, European responses to the pandemic varied drastically, calling into question the very idea of the European Union. What are some of the possible long-term consequences of the pandemic for the future of European states and societies?
Yeah, I mean, I think, maybe the EU has fared better than the United States, but only slightly. I mean, the foundations of the European Union have very much been rocked. The foundation of, freedom of movement under the Schengen Agreement, common economic policy, European solidarity, all of these things have really been challenged by what's gone on in the European Union. on a solidarity level, the fact that many member states sort of disregarded Italy's initial pleas for help dealing with the virus, that really shook everyone, I think. Of course, countries have apologized for that initial inaction since, but it definitely left a bit of a mark. Countries haven't been able to coordinate their border policies. They haven't been able to coordinate lockdown policies in any meaningful way. People have been stuck in transit between countries. They've been unable to return home. Goods have been sitting, in lorries at the border waiting to cross. And this is partially a crisis of competence. The EU doesn't actually have a competence for public health. So Brussels really could just sort of sit back and watch member states enact these policies by themselves. But the EU does have a competence with respect to economic policy, and even there they haven't fared so well either. You have countries like Italy and Spain that are very much lobbying for what they call corona bonds, or some sort of debt mutualization project to help sort of collectivize coronavirus related debt. And you have richer countries like Germany and Netherlands that want nothing to do with helping to shoulder that debt. Some kind of recovery bond will be implemented, surely, but that really only covers future debt, not past debt. So it's a really big crisis. The Italian Prime Minister and the French President have said, essentially, if we can't get it together and agree on these basic policies, then the European Union is definitely going to fail. You have enough Eurosceptics, especially in Italy and France. You have elections coming up, and you have enough Eurosceptic political parties that are eager to sort of use this as an opportunity to say we're leaving. So the very foundation of the European Union is pretty much at stake.
Thank you. Dr. Jackson, what can we take away from this discussion that decision makers need to hear right now, and probably more importantly, social activists need to hear, and ordinary citizens?
Thank you. Well, for social activists and ordinary citizens, I think there's just one message, that there's the big agenda, and the big thing for social activists, you can put it all in one bowl, and that is to elect a new president of the United States, because it does have a big effect on all of this. The idea that a man was, that Clyde has outlined, a man with such limited compassion or intellect in that sense, is in charge of all this. You see, social activism can mean something, but it has to be heard. It has to be expressed. Let me give an example. When they were the killings in Charleston, you had a president, made errors, but you saw someone who cared about the people, who went there. When you had the killings, in Charleston, when you had the killings in Charlottesville, you had a president that says plague on both our sides. You see, you had a difference in looks at things. When you have a president who cares about creation of jobs, of healthcare, of policies for people, then you have something. But social activists also need victories. The great German philosopher Kautsky and others said that the movement is everything, the end is nothing. But you see, that is wrong. The movement is important, but the end result has to be making sure that you have people that can change policies. Obama made a speech the other day, and he tried not to be so political, but it's just obvious that pretty much any sane person knows that if this crisis were in the hands of a person or leadership of people who really got it, who really looked science, who really sought to solve the problems, then we would come to a solution. Now, of course, it's all in the balance. What would it take? It's not so difficult. I don't know who, but a different change in leadership would be respected throughout the world. And of course, by people like me and African-American minority people in the United States.
Thank you. The COVID crisis starkly revealed the failures of many prevalent world systems, the lack of national and indeed international medical and public health preparedness, and of emergency infrastructures for dealing with disasters on this scale, the moral and actual financial bankruptcy of global and local governance systems that could not predict and preempt a disaster on this scale, the fragility of global governance systems and limits of international bodies such as the WHO and others, and of course we've heard calls for shutting down the WHO, the deep social inequalities engendered and amplified by globalism, the obscene and ever-increasing gap between the rich and the poor, the marginalization of large parts of the world's population, and the incompetence and utter failure of many leaders and leadership structures. When the crisis subsides, there will be anger and loss of trust in national and international institutions. And people will be open, if not demand, sweeping social change. This is a question to all of you. In your view, is it possible to imagine a different global order? Which systems remain necessary and which ones ought to be revisited and reimagined? And what role should governments play in a new global order? Please, go ahead, Anatol.
I think the basic structures of international trade have to remain, because otherwise, as I say, if we go back to the trade war against all, as in the 1930s, we risk economic catastrophe. We need more international agreements, dealing with and preparing to deal with different kinds of crises. But I think something that the pandemic has starkly revealed is that international agreements are only as good as the states which reach them, those agreements, and the willingness and the ability of states actually to implement those agreements. I would hope that the pandemic will lead in many countries to a greater stress on state efficiency, simply on making states work better. And also, following on from what Clyde said, a greater willingness to listen to science and listen to experts. Because I think that we are seeing, and we will see more, a growing divide between those sections of politics, politicians and their followers, who do base their policies in the end on reason, if you like, on evidence, on science, on expertise, and those who head more and more in the direction of irrationality and conspiracy theories. And unfortunately, this isn't just a matter of Trump. Richard Hofstadter wrote a famous book 2 generations ago called Anti-Intellectualism in American Life. The roots of this irrationality go very deep, perhaps not just in the politics of many countries, but in human nature itself. And I think we are facing a great test in many countries of which side, if you like, of the human intellect wins out.
Thank you. Colleagues, who would like to go next?
One of the difficulties that that this has revealed is that the best laid plans for pandemics are often, abandoned the moment you confront the reality of a particular virus. So we're actually pretty lucky this time. So this is a highly contagious virus, but it's not as deadly as we thought. The original WHO estimate of 3.2% would have been a disaster for the world, right? So I think the idea that a much more coordinated planning effort for various types of viruses is clearly intended. One of the funnier parts of this, or the saddest parts though, is that the CDC had actually created plans. And they had a plan for having a disastrous national response, for having a weak president who didn't respond well. And they had no idea. So afterwards they said, well, yeah, we planned for something that was a bit of a disaster, but we just had no idea how bad it could actually be. But we are in fact lucky with this virus. I mean, it is apparently not as deadly as we had thought. It's still going to kill a lot of people, and it's very contagious, and it's going to do a lot of disasters, but it could get much worse the next time around. And so I think the urgency of having better planning by the health community is really evident here.
Maurice, Amanda?
Go ahead, please.
Go ahead.
Well, I think one thing that it shows us is that we have to, especially industrialized nations, have to reshape the national priorities. If you look at the United States, just such a large amount of money goes to military budgets and things like this. Money has to be shifted. when you see a country that can write a check for $1,500 or whatever it is to large numbers of people, minority business, and help them at a certain point, it means that there is money within these national budgets to help small businessmen, to help kids who want to go to school, to establish health care, and so that people don't go into debt trying to have a better life for themselves. It shows the resiliency of capitalism. It's not going to fall tomorrow. It shows that that when priorities are put forth, now all the priorities aren't there yet, but for me, it's the reestablishment of certain national priorities, and the national priorities must be, in this case, for the health, the education, and the welfare of people within the United States, to get rid of these aspects of xenophobia, which quite frankly, it is not working as much as they are, because some of the things that have been said about people of color that Clyde and others have put out, in some cases, it's been a backfire against that. So I think that what this shows is that all of those people of goodwill and activists and things like that, if they get on the same page and demand that whoever the next administration is, and I hope it does change, reshape our priorities towards programs that really will help ordinary people.
Amanda?
Yeah, well, I mean, I'll end on a very idealistic note, but to sort of echo some of the comments of my peers, I think whatever we do going forward, one of the things we're gonna, have to sort of reckon with is reevaluating how we ensure the dignity of people in crisis, particularly vulnerable populations. It shouldn't be the case that assuring public health and engaging in sort of humanitarian politics are mutually exclusive, and so having more avenues of inclusion broadly defined will hopefully be something we see in the future.
Thank you. I would like to thank the panelists for their insights and everyone joining us today. I hope you enjoyed hearing from some of our scholars as they applied their knowledge to this unique global challenge. There are obviously some important lessons to think through about the legacy of policies, the interests of citizens, their local and national governments, and the response to global governance. I hope these scholars have helped to increase some of the interests, to increase understanding of some of the interests in conflict, and underscore that the reasoned and effective response to a crisis requires a diversity of voices at the decision-making table. Thank you. Please stay safe.